Okay, we're back for part 3 of our Benadryl lesson. So because that Benadryl wasn't being pushed through the line and being forced to go and spread out and circulate throughout my body, basically it was just cutting off the oxygen and the circulation to that area until the initial effect of it shutting down my vein stopped, and then it allowed the vein to open again, and then the Benadryl would circulate. Now, this is not something that I knew until it happened to me. And the reason that I'm talking about it now is because I think it's a very important lesson that we all need to know and we all really need to understand. Now, like I said, Benadryl, for whatever reason, is very controversial when we're talking about sickle cell patients. Now, if you're another patient, they pretty much throw it at you day and night. But for us, we have to fight and advocate and do all this other stuff. But when you do get IV Benadryl, as I said, for me, it's always last. One, it's because I get Ativan with my Benadryl, and Ativan has a horrible taste, and Benadryl is the only thing that makes it go away. But the more practical reason that I get Benadryl last is because if anything should happen to that vein, I want to know that I at least got my pain medication. Especially, like I said, if the IV is old and you already know the vein's going. And generally, the more painful, the more burning that you feel when they push your pain meds and your Benadryl, that lets you know uh, you don't have a lot of time. Also, you get natural swelling at the IV site when you get IV pain meds. It's a natural response. The swelling, the redness, the warmth from the medication, and it gets incredibly hot when you add Benadryl. So when the Benadryl and the pain meds are in the vein together, it's very, very warm to the touch. Just a little side note, because a lot of my nurses were really trying to say that I was allergic to morphine and Benadryl because of this reaction that they saw. And I had to teach them that it was natural and not a problem. But getting them to push the Benadryl, for the most part, it wasn't a fight, but I had to fight one nurse in particular. And bottom line, she really thought I was just trying to get high. I'm not going to push it faster so that you can, get whatever effect it is that you're looking for. And I had to let her know the only effect I'm looking for is to not have an ulcer in this area of my body. And I told her what happened with the gravity. And she said, well, now you're on a monitor and it's pushing it just fine. It's not a problem. And she walked out. Well, that monitor was only set to 50. I mean, not monitor, but the IV pump was only set to 50. So it really wasn't giving a lot of help. And basically, I had to turn it up to 200, 250, and get that Benadryl flowing and into my system and not being stagnant. And I would do that for about 2 minutes and then put it back on 50. The nurses who understood what I was trying to accomplish had no problems, and they would flush it with 2 2 saline syringes just to ensure that the Benadryl was getting out, circulating through, and also cooling down that vein. Like, there are so many reasons as to why you need to flush with regular saline after administering, these medications. And it has nothing to do with your patient wanting to get high. It has everything to do, though, with one, ensuring that the medication is properly getting a proper start, is circulating through the body and isn't stagnant. Two, you are offering your patient relief and you are cooling down not only that vein, but the area surrounding it, because that inflammation also responds to the saline being pushed through the vein, and it triggers it to start to come down. Unless you have a leak, then that's a different story. But I'm talking about that natural inflammation that happens right in here, right around the entry point of your IV. Um, the saline is very helpful in that, and it's very much needed, because if the Benadryl is allowed to just sit and take its natural course, you very much could end up with a scar like that on your leg in the future. Because once again, that Benadryl gets into the vein, and it just closes the vein off. Everything in your body goes dry, you dusty, you got cotton mouth like you didn't ate sand or a mouth of cinnamon or something else. And all of that is a natural response to an antihistamine. Now you say, well, why you should be able to take oral meds, and then you'll avoid the possible ulcer in the hot veins and all of that. Well, bottom line is that the oral Benadryl takes up, and 30, not 30 minutes is nice, 45 to 60 minutes to work, to get into your system. And once it's in there, it really isn't dealing with the burning. It's not dealing with the itchiness. It's not dealing with the hives. It's not dealing with the problem at the site of the IV. It's not. And 9 times out of 10, it just becomes a nuisance because you're frustrated. You're taking this medication because you're trying to control that adverse reaction to your pain medication, and the oral and the topical, they're not working because they're not designed to handle the problems that you're having from your IV pain medication. So, patients, when you're in the hospital, show your nurses this video, but let them know PO and IV do not act the same. It is not the same. And it is not the same by the simple fact that the route with which it enters the body is not the same. The topical cream, it helps a little bit, but you need immediate action. And in all honesty, you deserve to have the type of medication that is going to work the fastest and do the best job, period. And that is going to be your IV Benadryl. I hope this was helpful. I'll see you in the next video. And please remember that sickle cell is your superpower.